Good evening everyone. Today our class is about brachial artery. Okay, one of the important concept for 15 marks question as well as in the 5 marks. Okay, in this concept we are going to study about the beginning, course and termination of the brachial artery and relationships of the brachial artery, branches of the brachial artery and anastomosis around the elbow joint. Okay, next along with this we are going to study its mnemonics also. Okay, today's our concept is about the brachial artery. Before starting the concept, please share the video with your friends and classmates. Okay, now coming to the features. Features of brachial artery. In the features, see, the brachial artery is the continuation of axillary artery. Think that it is the axillary artery. It is the axillary artery and the brachial artery is continuation part of this axillary artery. That means here is the brachial artery like this. Okay, it extends from the lower border of teres major. That means here is the teres major muscle. It is the lower border of teres major muscle. Okay, it extends from the lower border of teres major muscle. Here is the teres major muscle and lower border of teres major muscle to the in front of elbow. It is the elbow. Think that it is the elbow. This part is the elbow part. It comes in front of the elbow at the level of neck of radius. Okay, it is the radius. It is the neck of radius. It extends up to the neck of radius and just medial to the tendon of biceps brachii. That means here is the tendon of biceps brachii. It is just medial. That is just medial to the tendon of biceps brachii. This is the features of the brachial artery. Next, beginning, course and termination of brachial artery. Beginning, course and termination of brachial artery. It is also same as that of features. That means it begins at the lower border of teres major muscle. It is the teres major muscle. Okay, it begins at the lower border and here is the lower border of teres major muscle. Begins from here and begins from here and runs downwards laterally in front of arm. That means, see, it is the lateral side of the arm. It is the medial side of the arm. Okay, it is the lateral and it is the medial side of the arm. It moves downwards and laterally in front of arm. That means if the arm is like this, see where our thumb finger is present, it is lateral and our this one little finger present at a medial side. So the brachial artery comes towards this radial side. That means at the lateral side in front of the arm and crosses the elbow joint. Think that it is the elbow. This part is the elbow. It crosses the elbow joint. It completely crosses the elbow joint and extends up to the neck of radius. It is the head of the radius, disc shaped head, and this is the neck of radius. It extends up to the neck of radius, Okay, this is the beginning, course and termination of this brachial artery, and at the neck it divides into two parts. One is radial artery and one is ulnar artery. One is radial artery and the lateral side. Radial artery is towards lateral side and ulnar artery is towards medial side. This is medial side. This is lateral side. This is the course, beginning and termination of the this brachial artery. And now coming to the relations of the brachial artery. Now coming to the relations of the brachial artery. See, it is the lateral side. It is the medial side. Okay, it is the lateral side and it is the medial side of the brachial artery. Now coming to the relations. See, see, it is completely superficial throughout it extends. Okay, that means it extends, it is continuous from the axillary artery, right? So from the axillary artery to the neck of the radius, the brachial artery is completely superficial. Next, we comes to the anterior surface. From the anterior surface, and here is the anterior surface, in the middle of the arm, that means, see, this is the brachial artery. This is the brachial artery. In the brachial artery, in the middle of the arm, and here is the elbow, and here is the disc shaped head of radius. This is the neck of radius. It extends from here to here. Okay. Next, at the middle of the, that means at the middle of the arm, it is caused by median nerve. See, it is the median nerve. Median nerve is present at the lateral side. At the middle of the arm, it is crossed. The median nerve is crossed. This is median nerve. Okay, it is crossed from here, from lateral to the medial side. It crosses from lateral side to the medial side, and at the in front of elbow, and here is the elbow. At the in front of the elbow, it is covered by bicipital aponeurosis, and here it is covered by bicipital aponeurosis. Here is the bicipital aponeurosis. At the middle, at the elbow joint, it is covered by bicipital aponeurosis. Okay, this is the anterior surface of this brachial artery. Now coming to the posterior surface, and at the posterior surface it contains triceps brachii, radial nerve, and profunda brachialis. At the posterior surface it contains triceps brachii, profunda brachial artery, and radial nerve. Okay. Next, at the medial surface, and here is the medial surface, at the upper part it is related to the ulnar nerve. See, at the upper part it is related with the ulnar nerve here. At the medial surface it is related to ulnar nerve at the upper part. And now coming to the lower part, it is related to the median nerve, because the median nerve crosses in middle of the arm and runs towards the medial surface. So at the lower side, median nerve occupies the brachial artery. It is the upper surface, upper part ulnar nerve covers, and at the lower part median nerve occupies. Next, coming to the lateral surface, here is the lateral surface. At upper part, it is related to the coracobrachialis. See, here we can see the coracobrachialis muscle. At this side, we can see coracobrachialis muscle. Coracobrachialis muscle. It is the upper side, and biceps brachii muscle, and median nerve. See here, upper side, there we can see median nerve. Okay, I repeat again: coracobrachialis, biceps brachii, and median nerve. Now coming to the elbow part, and here is the elbow. We can see tendon of biceps brachii. See, biceps brachii runs from lateral side, from upper to lower side. At the lower part, we can see the tendon of biceps brachii. We can see the tendon of biceps brachii. This is the lateral surface. Okay, we have completed the medial, lateral, posterior, and anterior. Now coming to the elbow, and here is the elbow part. At the elbow region, think that it is the elbow region. At elbow region, we can see median nerve. Brachial artery, biceps brachii, tendon of biceps brachii, radial nerve. Okay, median nerve, brachial artery, tendon of biceps brachii, and radial nerve. So the mnemonic of the parts that are occupied at the elbow joint is MBBR. Okay, like MBBS, it is called MBBR. That means median nerve, brachial artery, tendon of biceps brachii, radial nerve. Okay, this is all about the relationships of the brachial artery. Now coming to the branches of the brachial artery. See, in the branches, the mnemonic of the branches of brachial artery is branches. The mnemonic of the branches of the brachial artery is: see, baby, my professor needs some information regarding ulna. Okay, cancel this baby. Just to remember that, baby, my professor, MPNSIR and U. baby, my professor needs some information regarding ulna. That means, see, now coming to the M, it is muscular branch. It is muscular branch of unnamed muscular branch. Next, coming to the P, profunda brachial artery. Profunda brachial artery. In the profunda brachial artery, it is included both in this both anterior division and posterior division. Next, coming to the N, it is a nutrient artery. Nutrient artery. Now coming to the S, it is a superior ulnar collateral artery. Superior ulnar collateral artery. And now coming to the I, it is inferior ulnar collateral artery. And now coming to the R, it is radial artery. And now coming to the U, it is ulnar artery. These are the branches that included in the brachial artery. See, first one is muscular branch, second one is profunda brachial artery, third one is nutrient branch, and fourth one is superior ulnar collateral artery. This one is inferior ulnar collateral artery, next radial artery, next ulnar artery. These are the branches that arises from the brachial, that arises from the brachial artery. Okay, next next coming to the anastomosis around the elbow joint. Okay, mnemonic, I repeat the mnemonic. My professor needs some information regarding ulna. Okay, I hope you all understood. Next, coming to the anastomosis of the brachial artery. Coming to the anastomosis. See, anastomosis means connecting point between two nerves or between two bones or between any two. Okay, this is called anastomosis. See, in the anastomosis, we will I will draw here. This is the humerus. It is the lateral epicondyle. See, this side lateral epicondyle, and here this side is called medial epicondyle. This is the lower end of the humerus, and it is the head of radius, neck of radius, and here we can see the ulna bone. Okay, this is the elbow joint. So the anastomosis, we are going to study about the anastomosis in between the lower end of humerus and to the radius. Okay, in this point, see, lateral epicondyle. While studying about the lateral epicondyle, that means lateral side, the anastomosis at the lateral side, the mnemonic of that branches is, see, I will write here. See here, Anu and Ramu pretty intelligent. Anu and Ramu are pretty intelligent. This is the mnemonic of this lateral epicondyle. Okay, now coming to the point, the branches. See, even in the lateral epicondyle, we are seeing two types of the anastomosis. First one occurs at in front of the lateral epicondyle, and the second one occurs at behind the lateral epicondyle. Now coming to the in front of lateral epicondyle, anterior descending branch of profunda brachial. That means it is present at here, from here to the radial artery, from here to radial recurrent artery. Okay, A anterior for A, R radial recurrent artery, Anu and Ramu. Next, coming to the behind of this lateral epicondyle, posterior descending branch of profunda brachial anastomosis with the interosseous artery. That means here is the posterior descending branch to the interosseous artery. Okay, interosseous artery. Here is the posterior, pretty intelligent, interosseous. See, this one is all about the elbow joint, and here is the radius, here is the ulna, and it is the elbow joint, the space at the elbow joint. Okay, Next, this is all about the lateral epicondyle. Now coming to the medial epicondyle. The mnemonic of the medial epicondyle is I am pretty smart. I am pretty smart. Okay, remember that I am pretty smart. Now coming to the point, in the medial epicondyle, same as that lateral epicondyle, it is from in front and behind. In front and behind. Now coming to the point at in front of the medial epicondyle, it comes from here, inferior ulnar collateral branch of brachial artery. See here, inferior means at lower side, inferior ulnar collateral branch of brachial artery, anastomosis with the anterior ulnar recurrent artery. Anterior ulnar recurrent artery. Here is the I, inferior side, and here is the A, anterior side. And next one, at come to the behind, superior ulnar, superior means at above, superior ulnar collateral branch of brachial artery, anastomosis with the posterior ulnar recurrent branch of ulnar artery. Posterior ulnar recurrent branch of ulnar artery. Okay, superior, and here is the P. Okay, this is the anastomy. This is the point of anastomosis, how it occurs at the elbow joint. So remember, remember the mnemonic, and here the from at the lateral side the mnemonic is Anu and Ramu pretty intelligent, and from the medial side the mnemonic of it is I am pretty smart. Now coming to the clinical anatomy of this brachial artery. See the clinical anatomy, we are very favor of this clinical anatomy of brachial artery. See the clinical anatomy of brachial artery is, it is from the brachial artery we used to measure blood pressure, BP. Okay, we used to measure the BP, and from the brachial artery we take blood to test for some diseases. Okay, we used to collect blood from the brachial artery itself. Collection of blood for some clinical for some clinical conditions. Collection of blood, and in the condition of BP checking measurement, we use brachial artery. This is the clinical anatomy of the brachial artery. Thank you all.